Hi everyone, today we're talking about our new rhodiola product. So what is it exactly? It's a plant that's found in sort of cold mountainous regions of Europe and Asia. Its main bioactive or medicinal constituents are called rosavins and solidrosides, and these are found mostly in the roots of the plant. And this is what gives the plant its adaptogenic effects. So an adaptogen we've seen before in many other plants and products that we have, and it's something that is proposed to help the body adapt to stress and maintain homeostasis. And this includes both physical stress as well as mental stress. So we're just going to look at a few research studies here. So this was a study, a randomized controlled trial, where 2 different doses of rhodiola were given to subjects, and then they were given different mental tests. And it was shown that those that had taken the rhodiola had improvements in mental performance on these tests, including attention, speed, and accuracy. And that those that took 3 capsules, which is that middle bar, were slightly better than those that took just the 2 capsules of rhodiola, but both were showing significant improvement over the placebo, which is the dark black bar, or those that were given no treatment, which was the white bar there. Another study looking at cognitive function and mental performance. This was a study given where rhodiola was given to students during an examination period. And it was shown that those that had received the rhodiola had reported reduced mental fatigue, improved concentration, and overall performed better on the exams than those that were given the placebo. Specifically looking at depression, mood, and anxiety, there has been several studies to look at rhodiola in enhancing mood. One specifically that I looked at, they took rhodiola and took it alongside of sertraline, which is a common pharmaceutical drug used for depression. And it was concluded that the combination produced greater reductions in depressive symptoms compared to those that took the drug alone, and also compared to those that were given placebo. So given this result and the fact that rhodiola has far fewer side effects than higher dose pharmaceutical antidepressants, it could be a good combination to take alongside of the antidepressants. And then this study was looking at actual physical performance. So as I mentioned, adaptogens can help not only with mental stress, they can actually also help with physical performance and physical stress. So this was a study done where it was just a single dose of rhodiola was given to see if they could enhance endurance performance on a bicycle. And this showed here that the completion time trial on a bicycle was faster in the rhodiola group than in those that received placebo. Also, this same study, they reported that those that had taken the rhodiola reported a lower perceived exertion. So they were asked how intense they felt like the exercise was at different time points. And consistently, those that had taken rhodiola reported that they felt like it was less exertion, even though their actual physiological biomarkers were the same. So this suggests that rhodiola may improve this endurance performance primarily by reducing the fatigue perception. So dosing, generally in the studies, they're taking 200 to 600 milligrams per day. Because it can be mildly stimulating, it's probably best to take it in the morning. And then taking something that has been standardized to at least one of those constituents of solidrosides and rosavins would be a good idea to make sure you're getting a standard dose of the main medicinal constituents. Generally, rhodiola is very safe. There could be some minor side effects, dry mouth, dizziness, restlessness, and insomnia. And again, this is because of its stimulating effects. Headache and gastrointestinal discomfort. It might be best to even take it in the morning with some food to help prevent this. Use beyond 12 weeks, there hasn't really been studies to do that. So generally taking it for 12 weeks and then maybe taking a break from it is a good idea. And there are some potential interactions with medications. So someone should always check with their doctor before they take it. But honestly, I think most people could benefit from taking rhodiola at some point when we're feeling sort of high amounts of stress, either at work or at school. So this is a common herb that could be given to many different people. And here, I don't know why this image didn't show up, is the rhodiola product that we're just introducing is 200 milligrams, and we have standardized that to a nice dose of 3% of rosabins and 2% salidroside. So we know we're having a good standard product there. 1 capsule 2 times a day. I'd recommend maybe taking either both capsules in the morning with breakfast, or taking 1 at breakfast and 1 at lunch, and avoiding taking it at night, again, because of its stimulating effects. Thank you very much. As always, if there's any questions, please let me know.